Good morning. As Andrea so gracefully said, I had the honor of working with Rose this summer, and I swear it won't be the last this summer. It's my pleasure to be here with you all, and particularly talking about the Breast Friends Project, but I know we all feel so inspired and re-inspired by all the speakers that have been here. They have been awesome. So it's my pleasure to be here for the 11th annual Rose Summit, but particularly this one for Black breastfeeding and birth justice. So, for starters, taking a page from Dr. McLemore's book about making sure to address our positionalities. Of course, I am the fourth child of 5 children born to Black Caribbean parents who happened to come over the seas right before I was born. So it does make me a US-born Black woman who was raised in the Bronx, and I have lots of understanding about Black womanhood here, right here in the States. And so this project, for several reasons, is very, very exciting for me to be able to share with you all today, and I'm looking forward. Additionally, as a CLC and now as an IBCLC, I really started as a little baby researcher in undergrad. So I'm excited to be able to talk about research with you all today. And yeah, let's jump on in. Did it work? It worked, okay. Alrighty, so first, as you all arrive and have your breakfast, I just want you to allow your minds to engage the question of why is breastfeeding important, and why is breastfeeding particularly important for the Black community. So, as you think about that, I just want to bring up also, as an undergrad research, the reason I got into breastfeeding was noticing the racial disparities in breastfeeding. And so what you're going to hear today is that Breast Friends is a great opportunity to research, like we talked about yesterday, qualitative measures actually, as opposed to quantitative, because we are a storytelling people, we're a narrative people. So we'll get into that and how much all of that plays into the importance of Black breastfeeding, which is one of the main reasons why I was very excited when Dr. Bug and Tanisha and everyone was explaining what Breast Friends is when I first got on. The word I kept hearing was community-based and also the importance of breastfeeding, so I really appreciated that. So this is not the first time that we pondered this question, why Black breastfeeding is important, and these are 3 examples, 3 more recent examples of the fact that we've been talking about this for many years. We've been trying to interrogate the historical and sociocultural factors that affect Black breastfeeding outcomes. It's not the first time, especially in this room. We don't really need convincing that we need to interrogate those factors that have been affecting Black breastfeeding. And all of us are asking in many different ways. These are 3 examples, but in literally a million scholarly, community-based, all the ways, how best can we offer Black families optimal feeding choices, experiences, and opportunities at the start of life? And as such, we know breastfeeding is not natural, but we know it's natural but not easy. So we wonder, what is the gap? What makes it not easy? And we know that 99% of breastfeeding is support. So in comes the Breast Friend. The Breast Friend is a master affirmer, so someone who is able to comment on what you're doing in an affirmative way, which is very different as a current hospital-based IBCLC, and one of the few of color. I do know it is not uncommon to see discouraging and really negative forms of education and support, right? So we love that a breast friend is a master affirmer. It's someone who is experienced, it's a peer who has breastfed before, and it's a community member. And this community member is trained by Rose staff, and shout out any of the Transformers that are in here that are wearing their Transformers badge, that are Rose community Transformers. So we know that breast friends are very essential, and we're gonna talk a little bit about the preliminary kind of data that we see that people are experiencing with these awesome master affirmers in their life and a part of their breastfeeding journeys. So, what does the breast friend relationship look like? Well, so you know how there's usually like one, maybe two, at most three lactation visits when most people give hospital births. And everyone's like, okay, well, cool, we went through the basic education, but what happens when we go home? And I think Clifton raised this point yesterday about moving out of the medical and the healthcare model, right? So of course we can work on diversity, we can work on training, we can work on getting RNs, getting providers to understand breastfeeding and support breastfeeding and chest feeding more. But it is a whole different ballgame that has a whole different host of outcomes if you're able to provide support that is in the community. And then we can talk about like 8 weeks of support, which is what your breast friend is able to support you at least for, which is very, very cool. And breast friends are able to communicate in a multitude of ways. We had a pandemic, we have families who are having a harder time to be accessed by phone or by social media. So breast friends are able to go to your house, sit on your couch with you. Because where are you most likely to be having the hardest time because there's no support in your home? And as we talked about yesterday, and this is not the first time we're thinking through this, people are, one, most likely to have the biggest challenges once they get home and their milk has gone into the second stage of lactogenesis, as opposed to when we're just expressing some colostrum in the hospital. And people are least likely to seek care when they are already home in their communities. So a breast friend is definitely a bridger of at least 1 million gaps. And lastly, we value that breast friends have a shared experience with the person that they are supporting. And that experience, as we know in the socio-ecological model, that experience goes many layers there. So this person has been affected by the same community, celebrates in the same community, speaks your language. This is a person that is like your individualized breast friend, right? So, just to get a little more into the experience, and this is kind of more of the data piece, I do have some graphics to share with you all in a bit. But first, before I move from this slide, I want you to take a minute and think in your brains, what is a time that you've tried something new recently? Graceful pause. Okay, and what kind of support did you want from the people around you? Or what kind of support did you receive? And this can be with anything. What would it have been nice to have in the moment when you were trying something new? And it could have nothing to do with feeding, but I would love to hear what people have to say about this. So, another graceful pause, and then I will love to hear a few people think about a new experience they've had recently. How long are graceful pauses? Okay. Can anyone share a new experience that they've had recently? Any new experience that they've had? A hybrid event. A hybrid event, which we are all so thankful to attend. So that's a perfect example. And can you think, Andrea or anyone else, can you think of anything that would have felt really good or is feeling good to experience while you're having your first time doing a hybrid event? Okay. And any other new experiences that we've had lately?
Starting a new job.
Starting a new job. So is there anything you can think of that was helpful in starting the new job or that would have been helpful?
Well, everyone making me feel as if I'm part of the team already.
Yes, yes, yes.
Willing to walk me through answering the questions that I had. Just being very supportive and being present for me.
Awesome. Thank you for sharing that as well. So feeling brought into something and as we've already talked about, you all have a little bit of information. Thank you. You all already have a little bit of information on what the breast friend experience is like, but that's a perfect way to think about it. A breast friend is literally somebody, for those of us who have been like in organizations or anything, it's being brought in, right? It's having someone who's done this and saying like, come on, we're here. You can do this because I did it. So, hold on to any other words that you think of when you think about going into something new and being, wanting to feel in community there. So when I surveyed past and current participants and breast friend leaders, these are some of the words that popped up. And as you can see by the word cloud, support was the most common word. And I love the fact that whether you're starting a new virtual event at work, whether you're starting a new job, whether you're learning to drive, anything that you're starting in a new phase of your life, support is going to look differently. So these are some of the words, and I appreciated mostly, especially thinking about going forward with scaling up of breast friends and where it can go, thinking how they appreciated there was good training, that your breast friend was someone trained, that they were also able to share a common experience, and they were also able to share that they liked that your breast friend had access to other resources. Now, yesterday we started having this conversation, I believe the diaper bank brought it up. We started having the conversation about what it's like when you can go to one place for all the things you need, and especially when we think about access, that's really important. So this person comes to your house and gives you all the resources you need. So this was a very cool and affirmative moment to see what people's experiences were like in the Breast Friends Project. Moving on. I'm going to skip here, actually, because I'm really excited to share this with you all. Just a visual of where breast friends have been. And do you guys know that song that says, "Go Breast Friend"? No, it doesn't say "Go Breast Friend," that's my breast friend, but y'all know what I mean. So this is where breast friends have been, and these are the trainings that are demonstrated here on the left. And it is so exciting to me to think how big this can get because it works, right? We saw that in the word cloud. And lastly, I'll close out with just some directions that the participants and the breast friends leaders shared when gathering their feedback is that they would love, if they were able to win $1 million, they would put it toward outreach and reaching more moms and birthing people, but also more people who are able to be your breast friends and more breast friends leaders and further incentives for the breast friends leaders as well. So I'm really thankful, sorry, that was really I'm really thankful that I was able to share this with you all. I'm quite obsessed with this program, so I'm excited I was able to share this with you all, and I hope it plants a seed about the way that we are doing community work and research work in increasing better outcomes for our community. So, thank you all.